Welcome, everyone, to another Tuesday Hub Cure speaker series. This is our third in the series. We had a great one last week with Rahul Danda of Sherlock Biosciences. And this week, we decided to pivot a little bit away from diagnostics or therapeutics to manufacturing and advanced manufacturing and PPE. And I'm going to bring on Carolyn Kirk from the Mass Tech Collaborative. She's the CEO of the Mass Tech Collaborative in a second. But I also wanted to let everybody know that the MALSI Plus 2020 registration is now open. We've already had a bunch of people register. Would really encourage you to go there. Priya will put a link in the chat window for you. Once again, if you have questions, we're going to try something different today. Please use the Q&A function if you have any questions, and I will be paying attention to those. Jenny had to be at another meeting today, so she won't be moderating. I'll be doing, reading your questions. So please use the Q&A function to enter any questions you might have for Carolyn. With that, Priya, could you bring Carolyn onto the stage?
Hold on, Vineet. We're just having some technical issues. Carolyn, are you able to accept? There you go.
You're on mute, Carolyn.
Yep, got it.
There we go. Perfect.
Okay. All right.
Awesome.
You're on mute is the new, can you hear me now?
That's true. So the Zoom commercials won't have that Verizon guy. They'll have somebody else going around.
Exactly.
Are you on mute? So Carolyn, welcome to HubCure's version 3. We started this 3 weeks ago because I was just amazed by the response that has been coming from Massachusetts in response to the pandemic. And the way I like to put it is, we're perfectly situated to lead the world out of this pandemic. With every aspect. We were the first ones to do contact tracing. We jumped on the PPE issue. You jumped on the PPE issue. We've got diagnostic tests coming out. We've got Moderna with their vaccine. And so please welcome. And let me start off by just asking you to tell us a little bit about yourself and how you became CEO of Mass Tech Collaborative, and we'll take it from there.
Great. Well, thank you. It's really good to be here. And it's such an interesting topic. We're learning as we go, for sure. And it's fun to talk about the experience of the last 10 weeks and curate the lessons and see if hopefully they can be used in other parts of the country, but not necessarily used again in Massachusetts, hopefully, that this thing is under control. So I have been the executive director of the Mass Tech Collaborative for just over a year. And prior to that, I was the deputy secretary at the Executive Office of Housing and Economic Development. So that was a cabinet level position with Secretary Ash. And I joined the executive office when Governor Baker took office. So Jay Ash and I came in together. And so during my last year as deputy secretary, I was the interim executive director for Mass Tech. So there was an overlap, and it just became natural for me to assume the full-time position as executive director. I'm really excited to have taken on the position. I had been overseeing a lot of the work as deputy secretary, so it was a good fit. Prior to that, in 2000 through 2014, I was the mayor of Gloucester for 7 years. First popularly elected woman mayor. Served almost 4 terms. I left in the middle of my 4th term. And being a mayor really prepares you for a lot of things, mostly problem solving.
Yeah, that's a great story, and I think. Especially in these times, getting the population to do the right thing individually in order to help the collective is something that only I think politicians can do. I mean, certainly tech entrepreneurs like me and tech executives, we can come up with solutions, but getting people to do something not just for their own benefit, but for the benefit of society is not easy. And so tell us a little bit about the Mass Tech Collaborative for some of the people who may not be familiar with it. Of course, it's been there a long time. For some of us who've been here, we've known it, but
Right.
if you could give a little background on it.
Yeah. So it's a quasi-public economic development agency, been around since early 1980s. And it's evolved as the economy has evolved. And I would say that the mission is to strengthen the tech and innovation economy of the Commonwealth. And what differentiates us from other organizations that also focus on tech and innovation is that we hold the public square. We are the public entity. So our tent is very big, and we pride ourselves on bringing in the government partners when it's appropriate, beyond mass tech, industry, and academia. And that's sort of the hallmark of our model and how we work. And we have a number of divisions focused on various aspects of the tech and innovation economy: digital health, cybersecurity, advanced manufacturing, broadband, which is the focus in Western Mass for those communities that do not have broadband, and the Innovation Institute, which is focused on emerging tech areas such as fintech, artificial intelligence, robotics, quantum, a whole, what's around the bend is really what the Innovation Institute looks at. So the portfolio is quite big.
Yeah, and particularly two of those divisions, advanced manufacturing and broadband, I guess, have become very important in this response to the pandemic. Obviously, everybody now needs broadband. You can't go to school if you don't have access to broadband, since we've all gone remote. And it's always surprising to me that there's still many communities in Massachusetts that don't have broadband access. But let's park broadband for a second and let's talk about advanced manufacturing. So, you are leading this initiative that came out of the advanced manufacturing work that MTC is doing to respond to the immediate problem that we had in this pandemic was personal protective equipment for our healthcare workers.
Yeah.
Can you tell us a bit about that?
Yeah. So, I talked about that model that we use of standing up for our industry work, members of industry, academia, and government. And for advanced manufacturing, we had just that. We had what's called the Advanced Manufacturing Collaborative, chaired by Secretary Keneally of Housing and Economic Development, and Mike Tomasi, who is CEO of AccuRounds. So there's an infrastructure that was in place already. As soon as the pandemic hit, the manufacturing community stepped forward and said, how can we help? I want to make masks. I want to make gowns. I want to make face shields. And we were actually bombarded with these offers of assistance. So we quickly mobilized this advanced manufacturing collaborative, and we said, let's have a meet. Let's pull some people together, have a meeting, find out where we need to deploy resources. What is it that we're facing? So we pulled probably 35 names together, had a meeting. 50 people showed up on Zoom within the first week of sort of the emergency. And we have sustained that effort really to this day. And what we did was we met the manufacturers where they were at. So some manufacturers needed guidance on FDA regulations. So we said, let's grab an expert on FDA regulations. So we did that. Some manufacturers said, I just need help with testing. So we got them connected to testing resources. Some said, I need design validation or prototype. So we navigated that landscape. So really what we did was, as manufacturers stepped forward, we met them where they were at and mobilized the community of experts from UMass Lowell, WPI, MIT Lincoln Labs, MIT, and a variety of other places to support the manufacturers who were pivoting their operations.
You know, one example that I know of, because we had Bob Langer as our first speaker in the Hub Cures, and amongst other things that he's done, we discovered that he was partly involved in helping design that mask that New Balance is manufacturing. Okay. And I think the governor and you were at there it is, and you were at the New Balance factory last week, wasn't it?
Yeah.
Can you tell us a little bit about how that came about?
Well, New Balance. So so manufacturers came to this with a variety of motivations. Some of them said, we want to help. This is our civic duty and we want to help. Some said, if I don't find something else to make, my entire workforce is going to be furloughed or worse yet, laid off. So, there were, and we didn't care what the motivation was. At New Balance, their goal was civic duty and retain that workforce. So they went right into they have an R&D team already at New Balance, big multi-billion-dollar company. So they have a lot of resources. They also have their manufacturing capabilities to be able to pivot. A lot of their cutting machines can be programmed. So that R&D team approached us and we worked with them. We stood up a team and worked with them every single week, week after week after week, connecting them to a variety of resources. And they went into production right away. Now, a lot of the support that we gave was around labeling. Like, you can't label a mask for medical use if it's not tested for medical use. So this was our FDA expertise weighing in and our manufacturing experts understanding labeling and the importance of that. And so a lot of that was this guidance that we gave. So as long as New Balance was labeling their product properly and there was a market for it, because that was a question a lot of manufacturers had, was like, who's my customer? And that was a challenge throughout this. And so by the time all was said and done with New Balance, they came up with 3 or 4 different product iterations, and they rolled their millionth mask off their factory floor. And we went to celebrate that with the governor last week, and Jim Davis from New Balance, and the lieutenant governor and Secretary Keneally. And it was really kind of a great day. And it symbolized not only New Balance, but 99 Degrees in Lawrence, Marrow in Fall River, Brooks Brothers, which has a factory that's, struggling, but it's in Haverhill. There's just a whole host of companies that, I think all told, counting 4 million pieces of PPE still in production, have been produced through this effort to date, made in Massachusetts.
Yeah, I mean, it really feels like, one of those moments that come along every decade or 2 decades that allow you to make a pivot. We've been talking about manufacturing coming back to the Commonwealth and to the US, especially because of, these new sort of techniques like 3D printing and these machines that can be configured for sort of smaller batches. But it's amazing to actually put it in practice. It's one thing to talk about it theoretically, but right. You've had a firsthand view now over the past 3 months of this being put into practice. What's your feeling? I mean, do you think that advanced manufacturing is got the shot in the arm it needs to come back to Massachusetts?
Well, I think so. The governor stood up the command center, and the command center had a number of sub teams. One of the sub teams was the PPE team. And I was on that team. And that team was sourcing this product all over the world. And you've seen all the stories about N95 masks coming in from China through plane loads and states competing against each other and against the federal government and supply chains drying up. And, so I was peripheral to that effort. And my effort was really galvanizing the manufacturing community in Massachusetts as an alternative to all of that worldwide procurement. And it will come down to cost of labor and really the workforce being able to have the equipment and the support that they need to be able to produce in Massachusetts or domestically. I know for H1N1, I think it was in 2009, that pandemic that didn't overtake the world like this one has. The same thing sort of happened. It spun up. Everyone said, oh, we got to have domestic supply. And then that never materialized in terms of pandemic, and everything went back the way it was. And everyone just kept buying all their stuff from other places. This, I think, is different because as part of the MERT, which is the Manufacturing Emergency Response Team, we had buyers contacting us and buyers who sat in on our calls and said, get me a Massachusetts manufacturer so I can get supply into my hospital. I need it. I need a supply that I can rely on and that I can count on the quality. So there is the confidence in the quality. Has been shattered, I think, on some of the supply that's come in from other parts of the world.
Yeah, I think, this idea of a strategic response to something like a pandemic. I mean, we keep a strategic oil reserve, for example, to respond to, fluctuations in oil supply and demand. But it's pretty clear that we're going to have some sort of strategic capability to deal with future pandemics. And frankly, I mean, this one is nowhere near over yet, right? I think the news this past weekend was all about 20 states in the country seeing increasing numbers. We're seeing decreasing numbers here in Massachusetts, but large parts of the country are seeing increasing numbers. So how do you match that supply and demand? Because obviously there's now going to be demand coming from those states, right? As their hospitals get overwhelmed.
Yeah.
Is that part of MERT's role is to sort of?
Well, the demand question was the most vexing for us to answer for the manufacturers. First of all, you're talking about a manufacturer who has never sold into the hospital industry. They don't know how that works. They have no customers in that industry. They don't understand the procurement processes. And then you have buyers who have never bought from new producers. So the matching thing was very, very difficult. Other people stepped into that space to try to match it. But on the demand side of the equation, the demand is obvious. However, the manufacturers said, I'm not going to stop making what I'm making, which is reliable, and I know the business and I know who my customer is, even if I have to pause, unless I know what the demand is. So MIT Lincoln Labs actually did for us a demand model for N95 masks, gowns, surgical masks, and gloves over the next 18 months. And they did it against a disease model. And the disease model was like waves. It wasn't like second surge. It was it comes and it goes and it comes and it goes until there's a vaccine. And the numbers are staggering. And we invited the manufacturers into the briefing with MIT Lincoln Labs so they could see for themselves as they made their business decisions about whether or not they should get into some of this business permanently. So for example, 150 million N95 masks projected to be used in Massachusetts in the next 18 months. That's just Massachusetts.
Wow.
That doesn't even include Florida, where you can see the numbers that are happening in Florida. So but again, it's it's staggering, the demand, but you have to be able to quantify it.
Right. And of course there's, little things like margins and,
Yeah. Right.
because, yeah, people are only going to shift their business to this new business if it sort of fits the financial models they have for their business. I mean, it has to be at least some minimum gross margins, or it's not going to make sense for them to go into it.
So I see in the chat there's a question about N95 masks in Massachusetts, and if you don't mind, I'll just jump on that.
Go for it. Yeah.
So the governor did stand up a grant program. It was a combined funding from the Advanced Manufacturing Fund that MassTech has at its in its programs, and Mass Life Sciences, and it was about $10 million. And one of the grants is towards an N95 mask operation to be stood up in Western Mass. So it's a medical supply company. So they already have sort of the clean room. They already know the medical device field. They just don't happen to make an N95 mask. So that's going to get put into production with the help of a grant from the Commonwealth. There's another company in Massachusetts that is one of the very few N95 mask makers, and they're located in Massachusetts. They also received a grant to expand their current operations. So they're not a pivoting manufacturer, but they are a current manufacturer. So we are ramping up that through state investment, the capability to make those masks here.
That's fantastic. So if it's 150 million masks just in Massachusetts over the next 18 months, that would suggest in the US, it would be 20x that number, at least.
Yeah,
right?
The driver of the number, we were really surprised, was not just hospitals, but the long care health
right.
long-term,
like nursing homes and places like that.
Yeah, that was like twofold what the hospitals were, and the infection control measures just need to be completely rethought in those facilities. And MIT interviewed all of those folks to see what the usage was and tried to put the ideal usage, because you don't want to be wearing them for 5 days in a COVID positive environment.
So what other things other than sort of, gowns and masks, what other things has MERT been supporting where the need is?
So ventilators was, so the command center identified a number of priority items, and ventilators was one. And so two things came to us in terms of ventilators. One was refurbishment of existing ventilators. So we sourced a company and vetted them to be able to have them at the ready for ventilators that were in hospitals that maybe were out of operation. And so that was at the ready. And the second was, there were all these, well, we live in Massachusetts. We have an embarrassment of riches when it comes to R&D. So these novel designs for ventilators were coming out of our R&D centers. And those also needed some support in terms of supply chain and some FDA guidance. So we provided that support. And the other surprising thing on the ventilator front was parts of these ventilators are disposable. So there became a shortage of some of the disposable parts of the ventilators. And so we had some really smart people looking at how can you use 3D printing to make, disposable parts of it. Now, the ventilator problem in Massachusetts never got to the point where we had to trigger all those contingency plans, which we were very grateful for. But at the time, when you're hitting the surge, and we had some folks from Beth Israel, Dr. Zaidel, who's also the chief of Harvard Medical School. He was on our calls. He was sort of our medical advisor. You know, he's given us the update every other day, and you know, we were on pins and needles, so you just didn't know what was going to happen.
Yeah. So another question I got from the audience was, what percentage of that 150 million demand for N95 masks will Massachusetts manufacturers be able to supply over the next 18 months?
A fraction. I don't know I'd have to go back and look. Yeah, it's not a huge number.
Yeah, it's surprising that, well, even the one that was making N95 masks, obviously they're scaling up using funding from you, but they probably have access to private capital as well, right? To expand if the demand is there. Or is it just hard to expand?
Yeah, I mean, they're constrained by the equipment. So you can only run 24 hours a day. You really got to expand that. And there's lead time on the equipment. And yeah, there is some opportunity for, and a lot of, so whether it's a matching grant or, you know, I don't know all the details of the contract, but if we can give them the jump start that they need or help them offset whatever their margin might be as they, you know, figure out their debt or their financing for a piece of equipment. But the capacity isn't, we're not 3M. It's not Honeywell.
Right.
Those are the big behemoth 3M N95 mask makers.
Right.
But can they supply? Can they supply, be a steady state supply for hospital systems or the Commonwealth of Mass for its stockpile? They could make a dent in some of that.
Yeah, I mean, clearly, you know, pricing for these critical products will have to start reflecting their strategic value, right? So if the pricing for an N95 mask, increase, I remember there were people selling these N95 masks as huge markups,
right?
And everybody's so desperate they're willing to pay. But if you look at kind of the steady state price, it's just tens of cents, I think, per mask, right?
Well, so here's what we didn't do. We did not give any advice on pricing. We did not give any advice on legal advice. We did not give any business planning advice. I mean, the disclaimer on the MERT emails was pretty long,
right?
For all those reasons, we were a kind of a
facilitator,
a rapid response connector to resources that were on the critical path to get into operation to produce the PPE. And as we transition out of the crisis state, we're even not, we're having to back off giving the FDA guidance. And now we're telling companies, you got to go find your own consultants and your own experts to guide you through that. The testing will remain. That will be a capability that Massachusetts has. We did acquire a piece of equipment for UMass Lowell, and they are testing N95 masks and gowns. They're doing confidence testing. It's not NIOSH certified approval testing, although they could get there. And MIT is also doing different types of testing. And that was one of the backlogs that we saw in the system, is all the product had to be sent to New York, and the backlog was just like, 60 days. It wasn't doing us any good, but they got their hands on a piece of equipment and were able to test. They've done, in fact, the product that was coming in from China, MIT and UMass Lowell tested. They would take samples out of different lots and test them and then report back, and the bad ones got taken out and were held, and the good ones got sent along to the front lines. But that was a really important part of the work that MERT did.
The Kraft family and flew in their Patriots jet a bunch of N95 masks, got a pile of publicity, Can you tell us where that story evolved to? Were those used here?
Yeah, I mean, and then so it literally it was a chase worldwide. There was no limited support for the states. This is not a function that states do. I ran a FEMA operation out of my house, right. Trying to, and now they're calling me, and I'm like, unless you can be a customer for my manufacturers, But so the Commonwealth got in New York State, who I've talked to also about this, got really creative, and they just leveraged all their contacts in the world and said, where can we get our hands on this product? So 6 more planes came in from China to Massachusetts. So it wasn't just the Kraft plane, but it was multiple planes, and that operation was unbelievable because you couldn't maybe get it through customs, or every time it was called the Chinese virus, they might have stopped the plane from leaving Shanghai, and then it became a problem. Is it going to get here? And it was a nightmare. And I was, like I said, only on the periphery of it, but so much of it was unnecessary.
Yeah. In the midst of the pandemic response, we have geopolitics, right, to deal with. And,
right.
And of course, here we are focused on kind of our own backyard, which sort of takes me to broadband.
Yeah.
So, MTC was always sort of known for broadband in rural areas. Now it's mission critical, and it's not just in rural areas. So how's MTC sort of responding to that need?
Yeah. Well, so, this has been, this is a project that I've overseen since 2015, really since the day I joined the administration. And when I started, 44 towns did not have any broadband at all. And so right now, as of today, a prior meeting to this, the MBI board, the Mass Broadband Institute board, approved a grant to New Braintree, which is the last town to get on a path, which is amazing. And they decided to go with charter. So every single town is on a path to broadband. I don't have the stats in front of me, but I would say of the 44, maybe 17 are lit up. Another 10 are partially lit up, and a bunch of others are in construction. And then another bunch just got approved, like New Braintree, which has 2 years more ahead of it because they're so far behind. They couldn't make up their mind on how they wanted to proceed. So there's a whole tail of a timeline. So the way that we've responded to the towns that do not have broadband today is to set up Wi-Fi hotspots. And so the middle mile network, which Mass Tech oversees, which is a backhaul system, it has connections to the anchor institutions like the fire station, the town libraries, the schools, the big employers like hospitals out there in Western Mass. So hotspots have been set up. And so you have to go and drive your car and connect to the hotspot. And one of the board members told me today that people go from 3 to 5 and then they have cocktail hour.
That's funny.
Hotspot. They're socially distanced, and they do. Or I was like, no one's drinking and driving, right? And they said, no one's doing that. But
well, if they're at the police station, they better be careful.
Exactly. But it's become sort of this hub of activity around these hotspots. So
I'm curious about the backhaul. Is that a wired backhaul or is it wireless?
No, it's wired. It's called the Mass 123, the Mass Broadband 123 network. It was built about 10 years ago with federal stimulus money. It serves 123 communities, but it also goes through those 44 communities. And so that's called the middle mile. And then the last mile is going from that backhaul system to the residences.
Right, and that you're using wireless, I assume industrial grade wireless routers.
No, they're being cabled. We're planting
Oh, really? Wow.
60,000 telephone poles in those communities that have chosen to go with a cable or municipal broadband network. There's probably 6 of the communities that are doing wireless. So in order to get the towns on a path, we put as many choices in front of them as we could, and the town got to pick their path. So it's a heated debate: municipal broadband versus cable, Comcast, Charter, and there was some heated fights out there about this, or wireless. So some are doing wireless, some are doing cable, some are doing municipal broadband networks, but everyone's on a path.
Yeah, that's great. I have to say that, I'm here in Cambridge. We have a monopoly supplier of broadband.
Yep.
And I was really worried about our ability to work from home. I mean, we've got 5 people on Zoom calls at home at any given time. And hats off. I am now a fan of Comcast. Their infrastructure is holding up.
Yeah. I mean, it's a big company. They reinvest,
Right.
and they've been a good partner for some of these towns. But some of the towns said we want to build our own, and so we said, okay.
Right.
Right. I was a mayor, and I saw it as infrastructure. So if you run a water and sewer, I mean, it's not the same, but in some ways, it's the same. It's another.
Yeah, because you own it once it's put in.
Right.
And people, your citizens get pretty irate if like basic stuff doesn't work.
Right. Exactly. I would have been like, don't call me, call Comcast. I don't want anyone else.
Exactly. Well, this has really been delightful. Thank you so much for sharing these stories. And what an amazing job you and MPC and MERT have done in sort of again, the Massachusetts response to this pandemic. In this case, just for us and for our own citizens. But thank you so much, Carolyn.
You're welcome.
Please stick around on the networking. I'm sure people might want to chat with you.
Okay.
So we're going to move to the networking sessions. People, you can join any table by double-clicking on it. Carolyn will be on one of those tables. So I just saw a couple more questions came in. I want to make sure. Yeah, I think we pretty much touched on everything. But thank you so much, Carolyn.
Oh, you're welcome. Yeah, I look forward to chatting with folks afterwards, and thank you for having me.
Yeah, and your dog was really well behaved. I heard him barking a little bit.
Yeah, I walked him before I got on this call.
That was smart. Thank you.
Yep.